Hi, everybody. This is Dr. Eliana Aaron. I hope everyone's doing well. Today, we're going to talk briefly about the numbers, and then I want to talk about different strategies that have been employed by different countries and the positive and negative consequences in terms of case fatality rate and the economy and the balance that we're seeing and how that affects some of the numbers. Specifically in regard to my discussion about Sweden yesterday. I was talking about Switzerland for a while. Switzerland kind of became boring because they're pretty flat, and so are we, actually. We're pretty flat too. But Sweden, I thought, was an opportunity to talk about a different approach. So I do want to clarify that today. In addition to that, I want to talk about, based on a question that we had yesterday, after there were announcements but not policies that actually came out, and what some of the issues are in getting answers before policies are official. So I'm going to go ahead and share my screen and go through the numbers for today. What we have is 13,491 new cases, sorry, not new, total cases with 226 new cases. And you can see that the critical cases, the deaths, the ventilator rates are all going down. These are active cases. So what this is telling us, based on the model that I showed you last week, is that policies and social distancing that started between 2 and 5 weeks ago are now showing this consequence, which is a definite lowering of the curve of critical cases in Israel. So we like that. Epidemiology curve is reflecting the same thing, that we're in a downturn. Obviously, we want this to be even lower. We still have over 200 cases a day, and but relative to other countries, again, we're doing well in this regard. Percentage of new patients is currently at 1.68%. So you can see that's quite low. Now, in any model, that number is going to keep getting lower because remember, our cumulative numbers get higher every day. That number keeps going higher. And this is the percentage of new patients of a higher number every day. So that is going to keep going down. The only time this becomes significant is if there's a spike. If all of a sudden we're seeing that there's a spike relative to the number, the cumulative number, then we have a problem. But other than that, this is not a terribly significant chart. It's nice to look at. I like downturns, but only if there's a danger point do we need to be concerned about this one. The case resolutions right now, we like the way this looks. Remember, a few weeks ago, we were looking at Switzerland and it kind of looked like this. We're there, except with a lot less deaths in Switzerland. So right now, we're at 28% recovery from the total cases, and that's really good. Over a quarter, we're almost at a third, and I expect that this is going to become a much greener chart as things progress. Now, I want to quickly talk about the case fatality rates and what that represents. So I'm going to show you that chart, and then I want to explain that to you. Yesterday, I specifically mentioned Sweden because Sweden has a similar population to Israel. Their current case fatality rate today is at 10.71%, while Israel is at 1.27%. So it's quite a lot higher than ours, about 8-9 times higher. And the reason why I'm mentioning it is, and I have relatives in Sweden, and I am not trying to disparage policy or be political. However, the balance that each country has is economy versus life. It's very simple, okay? Now, there are some countries like Italy that has a lot more older population, so the life becomes a heavier price to pay. But in the case of Italy, the decision was not theirs. The policy couldn't even be implemented until the system was overwhelmed, because they were really, really overwhelmed, and they were the first country to be hit really, really hard. They're not even the highest case fatality rate anymore, but they were. what we are talking about is a striking between that balance, okay? So Sweden is the polar opposite of Israel in terms of policy. So now that works very well in a number of ways for them, okay? Because Sweden has kept their economy going, okay? So Sweden has decided, let's get the population exposed. That's okay. We're willing to take the hit, but our economy will remain intact, okay? So what happened there is the price that Sweden had to pay for that is a higher case fatality rate because more people in the population got sick, and the people who got sick died more quickly relative. Remember, this is a proportion. So even if they have the same number of people, and they do have a very similar number of people who are sick relative to Israel, but a lot more people died. Now, Sweden has an excellent healthcare system. We know that, okay? Sweden has a great healthcare system. It's socialized. Everybody has healthcare, and it's known to be one of the best ones in the world. What are some of the issues that they are having? Number one is they're not testing enough. They're testing people when they're critically ill or in the hospital. They're not testing people who have mild symptoms. That's the first issue. Israel had to play catch up with testing because we started off pretty slow. We're now at about 10,000 a day. We need to get up to about 20 to 30,000 a day so that we can test wider ranges of the population. I expect that if and when we get there, and it is a goal to get there, that will be done through the Kupat Cholim, and we'll start with the high-risk people and then the families and then move that way. And I think that would be really good if we could do that. But it's expensive, okay? So again, the decisions that are being made in Sweden have to do with money. So their economy is doing well. They're not spending a crazy amount of money on testing because their testing rate is about 40% of what Israel's is. And it's, again, similar population. And I personally don't think Israel's testing quite at the level that they should be at this point. But considering all that, then you go down to Israel, who did the opposite. We did extreme border closures. We did extreme social distancing. And the price that Israel has paid is that the economy has taken a real hit. Something like 26% of the population is on the equivalent of welfare or leave without pay from their jobs. And this happened very rapidly. It happened within about a month. So what we end up having is a lot of people are suffering either economically or health-wise. Now, as a healthcare provider, I personally, and this is very personal, but policy decisions are not personal, but as a healthcare provider, life comes before everything. It's one of the values that I hold dear as somebody who's Jewish and religious, but also as a healthcare provider. Now, life is the first and the last thing that we need to be thinking about in terms of protecting people. And Israel has done a pretty good job with that. I'm very proud of that. The price that Israel will pay and is paying is that the economy needs to be revised. Now, starting today, Israel started loosening up the restrictions. We briefly talked about it yesterday, and I am going to discuss it again today, but I'm going to discuss it in terms of a mistake that's going on with the government, okay? Israel, the prime minister got up and he made his pronouncements, some of which were not quite even accurate according to what actually ended up being passed. The way that it works in government is that you have regulations that you want to pass, and then they have to be voted in by either, in this case, it would be the cabinet or the acting government. And Israel's only have an acting government. We don't have a permanent government, unfortunately. But basically what happens is that in making the announcements before the laws are passed, is that the press runs with it, and the speculation of what exactly it means and how to interpret it. In fact, the Ministry of Health released information about it before it was ratified by the government. And this became very, very problematic, and they actually withdrew it. So there's a Ministry of Health app. They sent out the information, and then they had to withdraw it. So understand that speculation is very problematic, and the press should not be getting regulations before the government votes on them, because then what's the point of voting on them? The people have already heard what the laws are. The other issue is that some of these laws did not go into effect last night. And last night, people heard about them and started taking longer jogs and things like that. So it's problematic from a policy perspective to do something like this. And I think it's important for us to remember that when we're looking at policy and evaluating policy, we need to see the actual policy, okay? It can't be just what the Prime Minister said. The Prime Minister has made mistakes before. President Trump has made mistakes before. So we have to keep that in mind. So in terms of yesterday someone asked if they can, they are in charge of a mishpachton, which is basically a small home-based daycare center with 5 children usually. And she asked if she could run a daycare center for 3 people in her home, and she is 65 years old. So has it not been an issue regarding the ages and the concern for the elderly? Then the answer based on the legislation that actually passed is that yes, she could, because 3 families, as long as it's the same 3 children, she could watch them. The problem is, and this is where it gets a little tricky, can somebody her age be exposed to those 3 children? Is that safe? And that is really a question of interpretation of the law. It's not clear. And I hesitate to say that that is allowed and that is okay without hearing from a more authoritative body, which is the Ministry of Health. So that issue is being pondered right now. So it's not a clear-cut answer. And the reason why is simply because of the age of the person who runs the daycare center. So that's really the issue. The government did not put out any regulations whatsoever about people over the age of 60, 65. And that's problematic because those are the people who are honestly going to end up suffering the most because they're stuck at home and isolated. And frankly, a lot of them are getting depressed and lonely. And some people have been actually on their own following all the regulations all this time and not sneaking around. So very important. The other piece that came out when you actually take a look at the law is there are now fines for not wearing your mask properly or not wearing it at all. And there are actual potential jail sentences for people who are having illegal minions in their house, who are getting together illegally in large volume because they are potentially exposing large amounts of people to, in a hazardous way, to the coronavirus. And we're trying to move forward, okay? So we need to keep in mind the government is definitely taking a stronger hand on punishing people who are not following the rules. I drove today to a pharmacy and I stopped along the way and I stopped and said, your mask is not covering your nose. You breathe through your nose, you have to cover your nose, or you're not wearing a mask, or your mask doesn't, you don't breathe through your neck, stop wearing your mask around your neck. So, and I'm trying to, you know, I like to inform people and to educate people, but in the end, people are going to end up, you know, getting fined. So very important to try to keep to these regulations. That's what's keeping us safe. So let's remember that. I'm very optimistic that with the warmer weather that we're going to see continued downturns and in this trend, and that we will start being able to plan for fall. I wish everybody a good night, stay healthy, stay safe, and stay home. Take care.